What is detrusor underactivity, causing overflow incontinence? Imagine trying to empty a full bladder, but the muscles just aren't cooperating. That's what happens in detrusor underactivity, a condition where the bladder muscle, called the detrusor, doesn't contract strongly or long enough to fully empty the bladder. When this occurs, urine isn't expelled completely, so it starts to build up inside. Over time, the bladder becomes overly full, and because it can't push the urine out effectively, urine may leak out involuntarily. This leakage is known as overflow incontinence. In simple terms, overflow incontinence happens when the bladder is so full that urine begins to leak around the closed urethra. It's like a sink that's been filling for too long and starts to overflow. With detrusor underactivity, the bladder's weak contractions mean it can't squeeze out all the urine, leading to retention. As the bladder fills beyond its capacity, pressure increases until urine escapes without warning. This is different from other types of incontinence, like urge incontinence, which involves involuntary contractions, or stress incontinence, caused by weak pelvic muscles. People with detrusor underactivity often notice a slow or weak stream when they urinate, or they might feel like they haven't fully emptied their bladder even after going. Some may experience hesitancy, where they have trouble starting to urinate, or need to strain to get the urine flowing. Others might feel the urge to urinate again shortly after finishing, because their bladder didn't empty properly. Sometimes, they may also experience urinary urgency or frequency, which can occur alongside or separately from overflow incontinence. The causes of detrusor underactivity can be nerve-related or muscle-related. Nerve problems can stem from conditions like diabetes, multiple sclerosis, Parkinson's disease, spinal cord injuries, or previous pelvic surgeries. These nerve issues interfere with the signals that tell the bladder muscles when to contract. On the muscle side, damage or weakening of the bladder muscle itself can happen due to chronic overdistension, long-term bladder outlet obstruction, such as from an enlarged prostate, or persistent urinary retention. Diagnosing detrusor underactivity involves urodynamic testing, which measures how the bladder fills and empties. This test involves inserting small catheters into the bladder and rectum to record pressure and flow during urination. While symptoms can suggest detrusor underactivity, only urodynamic studies can confirm the diagnosis. Recognizing this condition is important because it guides treatment options and helps prevent complications like urinary tract infections or damage to the kidneys caused by severe retention. In the context of bladder health and bladder cancer, detrusor underactivity and overflow incontinence can pose additional challenges. They can increase the risk of infections, bladder distension, and even affect the success of treatments for bladder cancer. Managing these symptoms often involves a combination of behavioral strategies, medications, or in some cases, catheterization to ensure safe and complete bladder emptying. It's always essential for anyone experiencing these symptoms to consult a healthcare professional for proper evaluation and personalized care. In summary, detrusor underactivity causes overflow incontinence by weakening the bladder's ability to contract and empty fully. This leads to urine retention, bladder overdistension, and involuntary leakage when the bladder becomes too full. Accurate diagnosis through urodynamic testing is key to understanding the underlying cause and choosing the best management plan. Remember, each person's situation is unique, so seeking medical advice is always the best step toward maintaining bladder health.